Hi, good evening, and how are you? Welcome to another session of Ask the Doctors. This program holds every Sunday by 8 p.m. to 9 p.m. Nigerian time. My name is Dr. Frederick Unigbohai, and I'm the host of this program. This program has been going on for the past 6 years every Sunday. How are you, and where are you watching me from? I know you can hear me, right? We're streaming live on Facebook, we're live on YouTube, and we are also live on X, that is Twitter. I'm trying to see if I should go live on TikTok as well. Today's program is a question and answer session, meaning that if you have any question for me, you can drop it in the comment section and I will try my best to respond to you. So we're going to be very fast. If you have any questions for me, drop it in the comment section. I'll try and respond to you. Yeah, I can see Richard. Good evening from Abia. Richard, how is Abia State now? How you there? Yep. Let's see. I want to be sure that you can hear me. Let's see. I want to be sure. Let's see. Okay, good. My audio is perfect. We have Wise Man on YouTube. Yeah, the lighting is perfect. I love the lighting. Where's the iPhone, babe? Thank you. Yeah, hi, good evening from Ghana. Joseph. Joseph, how are you? Okay, let's see. I want to try and see if I can go live as well on oh, my stand is not here. Yeah, good evening. Good evening. I see you. The small one in my bag. Okay. Yes. Let's see who and who we have here. We have people watching us on Facebook, and we have people watching us on YouTube. Ada, good evening. Ada, how are you? Okay, now if you have any questions for me, feel free to ask me your question. Ask me tonight. I'll try. My co-host is Dr. Israel, and Dr. Israel will be joining us very soon. Yes. Yeah. Okay, let's see. Let's see. Watching you from Liberia. Afana, how is Liberia? Good evening, Valentine. Valentine, how far? So, Mary G's now. Use this opportunity. I hope you're aware that I don't give my number. I don't do private chat. If you are looking for consultations, you will have to go to the hospital. And if you wanna speak with me, you will need to book for a session. But here, you can ask me your questions and I will try my best to respond to you. Okay. Oh yeah, let's go. Prince, good evening. Watching from Kogi. How far now, Prince? How Kogi State now? See. Okay, nobody don't ask me question. I they call check, see how many people they watch me on X. I want to give a shout out to my people on X. Let's see if we are live as well on X. Thank you very much. I can see we have about 2 people watching us on X. Yeah. Okay, let's see. Who be this? Who be this? Who do we have here? I can't see. Geraldine, good evening. Okay, good evening. Yeah, I see you. Okay, no question for me. Good. Nice, it makes sense. Watching from Akwa Ibom. Watching from Asaba. Watching from Akwa Ibom. Okay. Keep the good work. Now, God, they do good work. Eclair, happy Sunday. Yeah. Now, in case you don't know, I tell you again. like this, we day on Facebook, like this, like this, we day on YouTube, like this, we day on X, formerly, you know the name, right? Good. So anywhere you they watch me from, I greet you specially, and you can ask your questions right now. Ask, no worry, no fear. The Bible says, "Ask and ye shall receive; seek and you what you shall find." Please, I have bladder infection. Which tablet is best for it? Your name na Chizoba. So this your question, they very wrong. Very, very wrong. How you take no say you get bladder infection? You see, you see the problem. You cannot just wake up and come and meet a licensed medical doctor. They tell and say you get bladder infection. They ask him for medicine on top social media. My guy, you know they work like that. No. If you true get bladder infection, you go hospital. Your doctor go prescribe medicine for you to treat your bladder infection. Not you looking for tablets to treat infection where we don't know where it come out from. Yeah. Watching from Ilorin, Kwara State. So if you get bladder infection, I take God and beg you, go hospital, and your doctor will treat you. We know they do that kind of one for here. I beg you, my guy. I think this is your first time where you come here. No hurry in life. Yes, I greet you. Have fun now. Good evening, doctor. Watching from Enugu, Nigeria. Finally, I see you. How far now? I just want to thank you and Dr. Israel for your consistency. It's not easy. I hope network allows me to participate actively. Yeah, I greet you specially. I see all your comments on YouTube. I see your comments. How far? How family now? Why are you skipping my questions? Why will I skip your questions? I can't skip your questions. I can't. I won't do that. I did scan 2 days ago. Listen, Mr. Man, and that is not how we make diagnosis of bladder infection. Listen to me, because some people look us like say we did jobless or we don't know what we talk online. You cannot wake up, my guy. Go do scan. Scan tell you say you get bladder infection, and then you leave hospital. You come internet, they ask for medicine. Oh, wrong now. Doesn't work like that. No, we don't do that here. We are very responsible. We are professionals to the core. We know what we talk about. And when I tell you, say, may you go hospital, it means say I need you to go to hospital. May them treat you well. My sister had cancer, stage 1. I'm also live on TikTok. I will join you live very soon, and I will take your questions on TikTok. My sister had cancer, stage 1. She had undergone 6 stages of chemotherapy. She's preparing for radiotherapy now. My question is radiotherapy compulsory? Okay, Ada, the truth is, I don't even know the type of cancer your sister has. And the doctor, the oncologist managing your sister would be in the best position to explain to you why you need radiotherapy. It's most times it goes together. It's a management plan. And if your oncologist feels that your sister needs radiotherapy, I want to believe it's in the best interest of your sister. It's not about compulsory or not compulsory. Now, waiting will help your sister. Nine matter most. And that is why I believe, say, they add the radiotherapy. Now, person will get cancer, no sweet, no easy at all. So I understand how you feel and the stress, the worry, the financial demand, the emotional turmoil, the easy. So I'm going to keep you my prayers, and I beg, follow your doctor's advice. If you get questions, ask your oncologist. I don't know the type of cancer your sister gets. I don't know. But may they explain everything to you. Let's go to TikTok and take one comment on TikTok. For the past 3 days, I have been having serious pains at the left side of my abdomen. So we can't diagnose you online, Michael, because making a diagnosis is not just about asking us questions. You will need to go to the hospital. You will need to be examined. How the pain be, the pain they work up. Sure you understand. You get anything where they do, where they make the pain come. Many things. Then they go find out too whether you don't get them before. They go can't know which kind of test you go do. So if they get pain like that, the first thing we most people they do is say that they always go take analgesic pain relief. But sometimes that pain relief no they work. The pain goes still dead here. And many things will give you pain for the left side. Pain will come from your intestines. The pain will come from your I don't want to mention other things because if I dey mention them now, you go think say now you get. Whereas maybe no be you get. Um, Doctor, why does elderly patients have systolic hypertension? The truth is that hypertension is not limited to the elderly people anymore. Hypertension is even now common among young people. Yeah, previously we see hypertension more in the elderly, but right now hypertension they among even young people. Why is it common in elderly people? Because as you they increase for age, as you increase in age, your blood vessels they go come become stiff. With age, the blood vessels gradually become stiff. That stiffness is one of the reasons for the elevated blood pressure. Good evening, happy Sunday. Watching from Ondo State. If you watch me, everybody share this live session. Share this live session. Good evening, watching from Osun States. From Osun States. Yeah, hi, is Osun States. I'm watching you from Texas. Hi, is Texas. From where? From Italy. I salute you. Please attend to me. I'm sorry. I know they see your comments. I know they see your comments. Let me see. Good evening. Let's see. Good evening. My 16 months toddler is not working. Should I be worried? 16 months. The toddler is supposed to be working right now. If the toddler is not working, is the toddler standing? Is your toddler making effort to even move at all? If the toddler is not making effort to move at all, enter hospital. Because by 16 months, normally, the pikin is supposed to don the waka or make very deliberate moves to start working. But if you're not there at all, this one, you go need to carry that pikin, enter hospital as soon as possible. Let's see. Oh yeah, everybody share this video quickly. I think say discharge is supposed to come from woman because after intercourse supposed to be white. What does it mean if the discharge is looking like brown color? So your question no dey complete, Mr. Daniel. Are you saying that immediately woman meets her partner, discharge they come out? Is that what you were asking? Normally, yeah, the discharge not supposed to be brown at all. Clear color, clear color, or some kind of other milky color. But if now brown is not normal, brown no normal. It be many things, but it's abnormal to get brown discharge. Let me take one more. I must go to hospital tomorrow morning. Yeah, thank you. I noticed say a lot of people they watch this video and now your first time with this. So let me give you a general disclaimer in case you never hear them before. I beg. If anything not clear to you, you won't ask. Fine, go ahead, ask. But if you they look for I beg which medicine I feel do, which treatment I feel do. No, I know they do treatment here. Here no be hospital. No. I'm not gonna put my license at stake because of social media following or likes. Never. Do you understand? I go advise you enter hospital. So if you dey find treatment, hospital, now there they go treat you. No be here. I'm not that type. I'm a professional to the core. I beg, no vex. Are we together? Oh, she has breast cancer. Okay, the affected breast. Okay, she had a mastectomy. No problem. Fine, 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 fine. Okay, okay. Ada, I understand right now. I did urine culture, heavy growths, a lot of bacteria was found, and all the antibiotics are resistant. Please, what should I do? Come, my guy, my guy, my guy, my guy. Who they send you for urine culture? I think you are doing a wrong thing. If you have resistance to all the antibiotics available, your case is special. You should be seeing a clinical microbiologist. You shouldn't be doing this online because you might be in severe danger if care is not taken. So what you should do is see a clinical microbiologist, or depending on the condition, see a specialist in that area. You cannot be having resistance to all the antibiotics. Now, problem be that. So, and the doctor will check you, which diagnosis you get, the duration of that condition, and find out if they can combine some things, if they can combine some antibiotics, maybe to help you. Please, what can I do to add weight? What can you do to add weight? Eat 3 times a day, gym to build muscle mass, sleep, take milk. It might help you. If it doesn't work, then maybe that is just who you are. Yep, 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 yep. Let's see. Good evening. I greet you. Good evening. Good evening. Good evening. Hey, Chief, how far now? Okay, so give me a few minutes to change the power. Are they come, yeah? Okay, let's see. I'm checking for your comments. Ivie Gloria, I see you. My sister is having pains in her mouth. That middle long thing before the throat. What do we do? Pain. Okay, so that thing, that middle stuff inside the throat, now they get pain. It depends, oh, it depends. It might be a bacterial infection. It might be a bacterial infection, or maybe viral. Now they cause inflammation there. So the only advice I will give to you here, your sister can use warm water and put warm water inside the mouth, do one like that and see, and take analgesic. Maybe it will help her. But if you no help her, sister go enter hospital. Let me see. Let me see. Good evening, everybody. Good evening. Good evening. Let me see. I am suffering from internal pile, but I notice my skin around the anus has protruded, though not painful. Not my intestine, but my skin. What could be the cause? How do you know that it is internal pile and not external? How you take know? Or is it skin tag? The truth is that it might be you have a skin tag. It might be a skin tag around that region. Yeah? Or maybe na external hemorrhoid you get. That external hemorrhoid, now be that. And maybe not the pain you. So there are two stuffs, Angela. It could be a skin tag or indeed external pile. So if you get external and internal hemorrhoid together. Let me see. Let me see. Doctor, I'm better now after the medication given to me by the gynecologist. My period is better and less worse. Congratulations, huh? Thanks for the advice to visit hospital. Well. Thank God. Say you go hospital. I'm happy for you, Congratulations. People are not sharing. Oh my God. Are you a doctor? Um, does scan fail when doing pregnancy tests? Well, scan does not fail. Scan not they fail unless na the machine bad. But if you are pregnant, scan go see your pregnancy. Anybody will tell you say the belly they hidden. Hmm? Anybody will tell you say your pregnancy scan no fit see am, say the pregnancy hide. Na thief be that. Listen, na thief. Na only thief go tell you say scan cannot see the pregnancy, say na special pregnancy be that. Those people they be thief, and they don't represent the medical community. They be thief. You know why they call them thief? Because then they outside and they talk this thing to chop some women money. So if you get belly, scan could definitely see the pregnancy. And anybody will tell you say the belly na spiritual belly, and all of them, they be thief. I get varicocele. Varicocele. I think you should see a urologist. Yeah, varicocele. Now, issue around your scrotum. You should be seeing a urologist as soon as possible. Yep. Let me see. Oh my God, the questions are much today. Oh. The questions are much today. What thing they happen? Okay. What kind of test do you advise? No, now. So listen, I beg, listen carefully. I cannot advise you to go do any test when me and you no get medical consultation. Dr. T, Alpha, are you available? Are you available? Send me message on send me message on WhatsApp. Let me send you the invite link. May I bring you up if you are available? Dr. T, if you are available, please let me know. Send me a message on WhatsApp, and I'll bring you up on the live session now. Yeah. Okay. Yeah. Ulcer and diabetes combined. Okay, let me go to TikTok. Sorry, I beg. Let me go to TikTok. Let me see. I feel numbness on my right hand. Doctor, what would you recommend for me? I would recommend that you go to the hospital so that we can find out why you have numbness for your hand, because we don't know what they cause your numbness. And come, everybody where they find recommendation online, no, is wrong. No, that is not how medicine operates. We know be magician, we know they do juju here, and we know they do shortcuts. If you get problem for your hand, what's be your name, guy? We need to find out what they cause the numbness first. And to find out, you go need to see your doctor. He go ask you many things. He go examine you. Go can't tell you go do this test or this test. When we can't know what they cause your numbness, then we go can't tell you what to do. Now, only people when know that the medical community go tell you say if you get numbness, go chop ginger. No, because numbness in the right hand can be caused by so many things, plenty. It could be your job, it could be your age, it could be your nutrition, it could be a problem from your brachial plexus, many things, plenty. Sure you understand? It could be trauma. Let me see. They always miss your sessions. Alpha now, guy, send me Alpha. Let me see. Are you here? Man, see whether you did online. Alpha. Let me see. Okay. Good evening. I greet you. The questions for TikTok plenty. Oh my God. Okay, so the comment on TikTok. I asked my question, but it seems you did not see it. Yes. Ask it again. Let me see. Well done, Dr. Fredostar. They always miss Sundays. Guy, have fun now. Thank you for this stuff. Send me requests now. Where you did? Wait, ma chat you up. How they come? Ma chat you up. Okay, yeah. Okay. So, let me invite Dr. Temitope here, so that we go plenty. Let me invite another of my medical doctor. Now the problem is that those on TikTok una go miss out because una no go hear or Timmy and myself. So I would advise everybody on TikTok to join me on Facebook right now. Yeah, I would advise everybody on TikTok to join me on Facebook. Let's see. Yeah. Okay. It's easy here. Yeah, let me do this. Let's see. Okay. Yep. Yeah. Okay. Let's go. Can ectopic pregnancy be treated without surgery? Most times, now surgery. Most times, now surgery. They treat them. Most times, now surgery. Now surgery. Now surgery. I need private consultation. Please send an email. My email is on the screen. Please send an email. This is the email here. This is my mail on your screen. Send that email. My admin will respond to you and schedule a session for you. Okay. Good evening. I did stool culture for typhoid test. Can I use it at any time I have typhoid? Justina. Thank you for this question. The thing is that the test for typhoid is actually a culture test. But it's not okay for you to just start testing yourself for typhoid. It's not okay. Yeah, we have Dr. Temitokbe in the house. He's live with us on Facebook, on YouTube, and on X. Dr. T, good evening. How are you there?
Hey, Dr. Fred, Alpha.
I greet you specially. Welcome.
Good.
So the problem is that I will have to end the TikTok live because those where they TikTok no go feel hear us here. So make all of them come Facebook or YouTube, no vex. Yeah. Yeah, happy Sunday to you. Baba, have fun now. Okay. For those where just they see Dr. T, he's a wonderful colleague, a senior colleague. He also know me many things. So it's great to have him in our midst. They come sometimes, but sometimes they busy. So make I introduce you to him in case you never see him before. Now we have a question. It says, is gastritis not curable? I have taken omeprazole recommended by doctor for a year plus. Dr. T, you want to respond? What's going on? Your network, Abby? Let's see. Okay, I think in network the hook. Let me see. Okay. Okay, in network, he's fixing it. Now, gastritis is curable. But the truth is that how are you sure what you have is gastritis? Let's see. Okay. Are you back? Can you hear me now?
I can hear you.
Okay, good. Okay, so somebody they ask us about gastritis. Is it curable? He has taken omeprazole. So my first comment to this person is how you take even know saying gastritis this because you're taking omeprazole for up to a year and it's not working out. So Dr. T, over to you, I beg, yeah.
So the thing with I hope everyone can hear me clearly. The thing with with goat disease is that it takes time. A lot of people want it to work overnight. I say using it now is I got the solution now. Gastritis, peptic ulcer, gastroesophageal reflux disease, esophagitis. These are processes, wear and tear of the lining of the intestine that happen over a period of time. And they have triggers, they have what caused them. Most of the time, we focus on treating what caused it. forgetting that after the thing has been caused, you have to allow for time for it to heal. For instance, gastritis, it's a wound. I'm going to be very lay. It's a wound. So we allow for that wound to heal. Now, if you want a wound to heal, number one, you remove what caused it. Number two, you make sure you don't go back to what will trigger it or slow down its healing. For instance, alcohol, stress, smoking, certain types of food. So you do your own assignment by finding out what kind of fruits, what kind of foods, what kind of lifestyle will trigger it, what kind of daily activity will trigger it and worsen the wound healing. Then you continue like that. Usually, if you allow it to go through like that, you get healing and you'll be fine. But the moment you fail to maintain the diet, the lifestyle, the triggers, to avoid the triggers, then you'll be battling with, oh, I'm treating it, it's going, it's coming back. So it will not be like as if, no, it's not healing. So yes, it will heal. Stay with your medications, stay with the lifestyle. The medication is not as important as the lifestyle. That's what we call maintenance therapy, to make sure that this wound heals and makes you free of it. I hope that is clear.
Yeah, thank you very much for that. Let's see. We have a lot of comments here. From TikTok. I'm from TikTok. Oh, I see you, Helen. Helen, you're welcome. Thank you for joining us from TikTok. Huh? Okay. We have a lot of comments here. It says, let's see. Good evening, sir. What is the cause of waist hotness? Okay.
See, so when you explain something as a client, I will not call you a patient. You have to understand that what it means to you may not be what it means to the doctor. If you say hotness, the hotness, is it pain? Is it aching? Is it burning? So you have to explain in clear terms. What do you mean by hotness? Your waist. Then what part of your waist? So in this case, you have to go and see a doctor. You will point to where the pain is, and I'll further explain what you mean by hotness. It may mean that your sitting position is bad. It may mean that you don't exercise well. It may mean that you have a waist problem. Maybe the bone or the muscle is fatigued. So this one, you need to go and see the doctor. It means that maybe one organ inside your bladder, your reproductive organ, something is going wrong there. There's no way we can explain hotness because you're the only one that's feeling it. So you have to explain clearer to your doctor. So please go to a clinic and get that sorted.
Yeah, thank you. If you're just joining us tonight, we are having a question and answer session. This program holds every Sunday by 8 p.m. to 9 p.m. Nigerian time. We've been having this program for the past 6 years, every Sunday. For the past 6 years, myself as the host with my co-host. Right now, we are live on Facebook. We are live as well on YouTube. We are also live on X. If you have any comments, any questions, please ask us. We'll try our best to respond to you. And we'll also let you know that this place is not a hospital. And we don't treat here. We always tell you to go to the hospital for treatment. We're just here to clarify, to advise. Whatever is not clear to you, ask, try and break it down. But if you are looking for treatment, no, hospital. What is the best treatment for hernia or hernia, whatever name you call it?
So this thing about best treatment, best thing to do, best. The best remedy for any disease is specific to you and specific to that disease and specific to how far that disease has gone. We have so many types of hernias. So if you say hernia, which one of them is the hernia? How far has it gone? What's the degree? What are the symptoms and what are the complications that have happened? So to get the best, you need to go and see the doctor. They will examine and evaluate how far the hernia has gone. Where is this hernia? And now look at the best tailored response or treatments to you. Most of the time, the hernia, if you understand what hernia is, hernia means This organ is in this compartment. It left the compartment into another compartment through an opening. So you need to go and see your doctor to say, okay, this hernia, is it a mild one? Is it a moderate one? Is it severe? Is it causing any complex problems? And how do we manage it that it will be best for you? So there's no best treatment for any disease. It's tailored to just you, specific for you.
Permit me to say this. I know sometimes because we are very active online, we see a lot of people tell you that if you have hernia, there is a tea they can sell for you or to you. There's a tea, a hernia tea, and a lot of people they come across those stuffs and they are confused. If you fall into that category, let me just say it here right now that and there is no tea that can cure hernia, and there is no hernia tea, there is no hernia herb that you will drink that will cure your hernia. It's very important so that your mind go dey clear first of all, because if you drink that tea, you have just succeeded in wasting your money. And like what Dr. Emitope said, if you have hernia could be very big. Depending on the type of hernia you have, your doctor will look at you and say, even your lifestyle to many things, I will tell you, oh, this hernia, give it time. Oh, you have to come back. We have to do this. Sometimes too, they might have told you the treatment at the hospital, but maybe you are looking for us to give you another treatment so that or another advice online. No, now, it doesn't work like that. What is the cause of axillary web syndrome? Axillary web syndrome, I believe you know what it is, Ada. Yes, you have asked me a question earlier about your sister with breast cancer. This condition you are asking me is common with your sister. You understand? Yes, you asked this question, and I want to believe you have done research. It's common among those people that have gone through surgeries around that area where your sister had the surgery. It's common there. Yes, yeah. Good evening, doctor. Please, what can be the cause of side headache that will come and go, like sharp one come once, you go and come back like that sometimes?
There are some questions that we ask, and we expect that the doctor should read your mind or should divine in your mind. Most of the time, we may not know. We have to ask sound number one: when do you notice it? What events are you doing, or what are you doing that makes you notice it? Number two: what is your blood pressure? What is your sugar level? How big are you? What is your diet like? How much sleep do you get? If you say the side of your head, there are blood vessels that go through the side of your head. There are muscles that are there, the one used to chew. Your skin is there, your bone is there, your skull is there, your brain is there. Usually, it may be from some form of stress. Your blood pressure is raised, you're not getting enough sleep. You are focusing your eyes on computer screens or phone screens. It may be migraine, which the cause may not even be known. So you have to understand that if you say, oh, it's coming and going, it's at the side, it may be blood vessel, it may be muscle, maybe your eyes that's actually sending pain to that side. It may be your sleeping position, it may be coffee, it may be cigarette. So it can be a number of things. Your duty now is to now sit down and be the doctor of yourself. When do you notice this headache comes? Is it when I eat something hard? Or is it when I drink coffee? Or is it when I've not slept? Or when I'm in the bus, when I'm driving for a long period? Or if I'm working on computer screen for a long period, or doing TikTok for a long period? You can now find out, oh, this is where the problem could have come from. Then you now modify those behaviors and see if there's a relief. If there's no relief, then you now start to talk about seeing a doctor and investigating. Test maybe, examination maybe. I hope that clears it.
Thank you very much. Okay, we have less than 20 minutes to round up. We have a lot of questions, but I noticed that Una not they share this live session and Una they ask questions. Why? My people on YouTube, I have a lot of people watching us on YouTube right now. People on YouTube, I beg, if you get questions, drop your questions. Please, Helen is from TikTok on watching us on YouTube. Helen, I beg, drop your questions so that maybe we take some questions from the YouTube community. But we know they see una comment, una questions. That is why I beg. So drop your questions and we'll try to respond. Let's see. Um, God of heaven. Good evening, doctor. Um, I just joined now. I ran a hormonal profile test and the results said high prolactin. I was placed on Despalodel over a month now, but yet no ovulation. What could be the cause? From Sandra.
Again, doctors are not magicians. Medications are not magic wands that you wave and everything becomes normal. The doctor has found out likely causes of what is causing your prolactin to go high. Allow for processes, allow for time. Prolactin high means that the body is telling, or the hormone is telling the body that, look, we are breastfeeding somebody. Don't kickstart ovulation. Suspend ovulation first. We are producing milk for a baby. That's what the high prolactin is saying. Now, if you have a medication that is lowering the level of prolactin, you have to allow for time till the signal stops telling the ovary that, look, there's a baby. Now you can start ovulating. My advice to you, Sandra, is to continue your follow-up visits, continue and complete your medication for the period where the doctor says you complete it for, and wait for your body to revert to what it was before the prolactin level became high. Your ovulation will come. While they are doing that, always also talk to the doctor that, look, doctor, what other thing can cause me to have problem with ovulation? So they will do other tests, other investigations to find out. Patience, patience, patience.
I don't drop my question twice already, so I would prefer a private section with you, Doc. Your questions, we know they see your questions. I guess maybe YouTube they filter some people's comment right now. I think so, because show, no vex, vex, show, show. If we show, you know what we do here. We go read them. Let's see. Let's try to be very fast. Please, doctor, can gastritis cause bleeding?
Yes, it can. Simply, gastritis can cause bleeding. Because what is itis? Itis is inflammation. Gastro is the stomach. So if there's inflammation of the stomach, it may get to a point where the layer where the blood vessels actually supply the lining of the stomach are exposed. It can now cause bleeding. So two ways. You can either cough up the blood, or when you vomit, your blood in the stomach will irritate the stomach and can initiate vomiting. Or you now notice that your poop has a darker color. That's what we call it altered blood. That is, the blood has been digested, it has been acted up by some enzymes. Just as that every poop you eat, even if it's noodles, if it's okay, you eat, it's dark brown or deep red. So yes, gastritis can cause bleeding in the severe cases.
Okay, we're trying to be very fast because of time. Let me see. Let's see. Oh God, oh God. Oh, wahala. I always do what? I am always weak, but not walking yet. What could be the cause? 50 years.
Wear and tear. Wear and tear. Wear and tear, that is, you are advancing in age. Your bones, your joints are not like what they used to be before. So you need to look at how do you maintain your joints, your muscles, your bones for your age. Number one, look at your activity. Are you straining? Are you still assuming you're still young, doing all this strenuous work that you were doing when you were younger? Number two, what is the output? Number three, what is the input? How are you eating? Your diet should be modified to fit your age because your absorption, your nutrient absorption, your mineral absorption is not the same as when you were 20. So you have to modify your diet to fit your new age. And finally, you need to look at what are those things that I may have now that may cause the wear and tear to be faster. For instance, high blood pressure. For instance, diabetes. For instance, osteoarthritis, that is the bone, the joint. Are they having problems moving together? So if you're feeling weak, go to your doctor, let them do a checkup for you, an age appropriate checkup. I didn't say you go and do general checkup, age appropriate checkup to find out here, what is your blood level? How your vitamins and minerals, what are the levels? What is your exercise routine? Where do you work or how do you work? What are your stress levels? Go to the hospital and find out. Then it's just fine for your age to do routine exercise. You can also research here to find out exercise that you can do for your age range.
Doctor, when I wake up at night to urinate, I always feel like falling down. It happens almost every night. What could be the problem? It's always very serious. My full blood count result is normal. Sugar results are also normal.
So what you are having, I did a video about this a while ago, is what we call orthostatic hypotension. That is when you change position, especially when you're lying down, you come up, your blood pressure will drop because of the way the blood distributes because of gravity. That may be the case that you're having, especially if it's when you are lying down, you stand up. That may be the issue. Focus on regulating your salt in your diet. Focus on your exercise routine. You can change the position of your bed. And of course, how you get up, you can do it gradually instead of just jumping up. Please, they catch me, I run, go toilet, go peace. No, you may want to modify that. Most importantly, still check with your doctor. Apart from doing tests, everything is not test. I did test. No, still check with your doctor. When you are discussing your doctor may be to point out certain things in your routine that could help point to where the problem is.
Okay. More questions there. Please, a man who is above 50 years old and has not had sex for a long period of time, would there be any problem with that for him? Okay, Dr. T's network is not networking. Okay, if the man is 50 years old and let me see, are you back? Are you back?
I can hear you. Funny, I'm here.
Okay. Oh yeah, now go ahead.
So the thing with this people that talk about abstinence, if I've not done it for a long time, nothing spoil. If you like, never make way. Let me use Dr. Fredostar's language. Never make way from birth to death. Nothing spoil. There's no side effect. There's nothing stuck in your body. There's nothing accumulating. It just means that you've not had the opportunity to release. Nothing is wrong. Nothing can go wrong. So let's remove our mind from I must do, or something is wrong. No, there's nothing wrong. I hope that is clear. Nothing, there's no side effect, there's no disadvantage.
Oh yeah, you don't hear the answer. Okay, we have a comment on YouTube. I don't see one YouTube comment. It says, infection fit cause may. I want to believe you're saying infection fit cause make woman no get belle. Make I respond quickly, no vex. The reason why I won't respond because this question, if you get how people they ask them and they bad, you get many things if you make woman no get pregnant and infection no go there. As a matter of fact, the woman feel no get belle because of man. woman fit no get belle, and the problem no go be the woman, the problem go be from the man. So when a woman they find them difficult to conceive, to get pregnant, you no go good make you just wake up say na infection. The best thing for you to do be say the woman and the man, because for this part of the world, when woman they find belle, they leave the woman, make only the woman they work out. The man go sit down for house, go cross leg, they read newspaper, and who knows, it maybe that the man get problem as well. So waiting with the advice, we say if you be woman or you be man and they try to born pikin and they come, make the man and the woman make una two carry una self go hospital. They will come do many tests, because infection self fit no dey among wetin dey cause am. Can infection affect? Yes, but that one no dey top for the list. Shey you get? So that may we no go answer this question one way, you can't blame the woman saying that she go carry infection for her body, whereas something else fit dey there, or even if he even be say the man get the problem. Dr. T, you want to add anything on top of this?
So in addition to the problem, let's even focus on infection. Let's even say an infection even cause the woman to have problem. So particular infection. The man will be the one where they give the infection. You don't treat the woman, she don't use antibiotics, tire, she don't use medication, tire. But she still go meet the man, when no gree go hospital, we carry the thing for body. Anytime she treat herself, she go meet the man will deposit another batch. So when we treat problems with fertility, problems with reproductive organs, problems with the reproductive system, we treat both husband and wife together, because we know two of them, they come together. So if you treat one and you leave one, you have not done anything at all, because the one where you know treat go still come deposit again. And people where they carry speaker say, infection, staphylo, staph, they are milking you, trying to make money from you. Because like Dr. Fred said, infection are one small fraction of waiting fit cause make you no get belle. So it's better you go to the doctor, you and your husband, you hold on yourself, because two of them are involved. I don't follow person fight where they say in wife they get problem, and they say, it's my wife now, I don't need to do any test, it's my wife. I shout for her. So both husband and wife need to be checked. Whatever screening they do for the husband, they will do for the wife. If na infection screening, if na fertility screening, they will do for both of them, because the wife know they carry get belle for herself. So both of them have to be screened.
Yeah, thank you. Yeah. Questions. We are almost out of time. I can see people on Facebook, on YouTube, on X. I see you. Those waiting for X, I see them here. I see their numbers here, as well as Facebook. And we are almost out of time. Good evening, Dr. Abeg. Biko, make una no laugh me. I need clarification. I always have urge for mekwe before my period and after my period, though not married or in a relationship yet. Hope it's not spiritual, as my mom is saying. Thank you.
Okay. So, choice. You need to understand that you have cycles. And your hormonal cycle is always funny. There's a cycle where your body will tell you it's near man. And that is usually around your ovulation. That is, your body don't drop egg. You're going to push you, say, fine man. Many people don't notice it. But that urge to make way, now your hormone telling you, say, I don't drop egg, go find person, go deposit, put for your way. So it is a natural phenomenon. Now, some people, we know, say we get greed. Some people won't pass some other people on. Some ladies won't pass some other people on. But your hormone is on acting. So after you don't do the deliverance, because I know say your mama don't carry go do deliverance. After you don't do deliverance, tell your mama, say it is normal. Nobody say the deliverance no work. Your hormonal levels, the way they fluctuate, allow or make your body to want intercourse with your man or with man, so that belle will form. I hope you record this message and show it to your mom too. So yes, so they go do their deliverance, but please, it is not abnormal, it is normal for you.
Okay, it's normal. Ladies and gentlemen, we are almost out of time. Let's see how fast we can go with this. If you haven't shared the live session, share. This program, remember, is every Sunday, 8 p.m. to 9 p.m. This is what we do to give back to you on the platform. Sometimes we teach, we talk about the topic, sometimes we respond to your questions. So today is a question and answer session. We are almost out of time. Doctor, since I gave birth, I have right joint pain. Is there cause for alarm?
Your question is not clear. On the right, is it the shoulder joint? Is it the joint in the ribs? Is it the joint in the hips? Is it the joint in the knee? Right joint is not, it doesn't help me diagnose the problem. Right side is the whole half. So maybe it's the way you sleep. Maybe it's the fact that you had a big baby. Maybe it's the fact that your body has just changed from when you had the baby to when now that the baby has come out. Maybe it's the way you posture yourself, you're sitting. Maybe. So it's a lot of maybes, depending on which joint you're referring to. Your duty now is to go and speak to the doctor and point, doctor, it is here that I'm feeling the pain. Don't just say right joint pain. You say, doctor, this is where I'm feeling the pain. Doctor will now tell you, okay, did you deliver normal delivery or did you do CS? Is it one baby you produced or two babies? Was it a big baby you produced? Was it premature baby? What was done after the delivery? Did you attend a proper postnatal care? Did you eat properly? What's your nutrition like? How well are you resting? Is grandma doing omogo for you properly? These are the things that they will look at and find out what the cause is. Are you eating properly? Are you absorbing the nutrients from the food properly? So please go and see your doctor to know where the pain is coming from and the solutions.
One more question, and I think we are done for today. For those people who we couldn't respond to, I think you will join us next time. If ulcer is if ulcer is one if ulcer is what injury, gastritis is what? Because my scan result shows bowel gas movement. Who they diagnose you of gastritis with scan results?
Yes, this person has you have mixed the whole thing. In fact, I even as a doctor, as I'm hearing this thing, I'm seeing this thing, I'm already getting confused. Ulcer is a wound. Ulcer is diagnosed by looking. We may do other tests to put us towards, okay, is it gastritis? Is it ulcer? What is causing the ulcer? Ulcer is diagnosed by looking. That is, they will put a camera into the throat to the stomach and see what is causing the ulcer. Gastritis is gastro, like I said, stomach. Itis, inflammation of the lining of the stomach. Ulcer, or what we call ulcer, peptic ulcer, is a broad name. It can be gastric ulcer, it can be duodenal ulcer, it can be jejunal ulcer. These are names of parts of the digestive tract. So when we say ulcer, there's ulcer outside the body too.
I can't seem to hear Doctor. Okay, sorry.
Two,
Yeah, he's back. Yeah.
yeah, no scan can diagnose you. Number two, go to a government hospital or a government or an hospital that they have the equipment to diagnose you. Not just carry enter any lab, say you want to do tests and they tell you an ulcer and they don't give you medication. Scan cannot diagnose, X-ray cannot diagnose ulcer. So please go and see a doctor and maybe they will explain this situation to you so that you understand properly. Gastritis is gastro, stomach. Duodenitis is duodenum. Jejunitis is jejunum. Peptic ulcer is usually the whole gastro, duodenal, jejunal ulcer. I hope you understand.
Thank you so much. We are out of time. Doctor, my wife don't know when she's ovulating. I hope all is well with her health. This is not something to be worried about. Most women don't know when they are most women. So they are taught, they are doctor, they explain, they teach them. Nobody say because your wife is not aware, then problem can't dey for her body. Many women, some women don't even know at all, and they gave birth to 6, 7 kids. You understand? But your wife can
Yeah.
go online. There are videos. We have videos she can watch that will guide her. There's a video I made on YouTube. Dr. Timothy also made some videos about it. So it's not something to get scared about. Just let her get information, watch the videos, speak with her doctor, and everything is okay. Dr. T, any final comments as we round up tonight?
Uh, well, I think I should say thank you for giving me this privilege. I'll just lying down. The weather is cold and everything. So, if you want your health to be optimum, remember that before any human doctor, any doctor anywhere, you are the first doctor for yourself. You are the one that will know that there's something wrong before you go and take it to the doctor. The doctor will only listen to your story and now look at what you have as your own personal doctor results. I now use my own judgment to now judge based on my experience and my exposure. So be sensitive about your body, listen to your body, and be quick to present to an hospital. No go fall for hand of person where go chop your money and cost you double wahala. That's my take.
Thank you very much. And for you that joined us tonight, thank you for joining. Don't forget, next week Sunday, we'll be here by 8 p.m. to 9 p.m. Please, I beg, to all the people where they talk, say they won't follow me talk. Maybe except for one person, for all the whole people here. If you send email and the whole stuff, you go pay for consultation. Oh, please. Then don't no go think say this doctor, thank God I can talk to him. No, no, no. I don't get my time to
Mhm.
the give out like that. Please, you will book for consultation. And as advised, please go hospital, see your doctor and check you. Thank you so much. We'll see you next week, Sunday. Like I always say, good life now waiting. Good life, good life. Now sense. Take care and have a wonderful week ahead. Bye bye.